Welcome everyone. I'm Sonia Sidhu, Member of Parliament from Brampton South. I want to thank you all for joining us here at the Boys and Girls Club of Peel. And thank you the work they are doing. Especially shout out to Michael Joy, who's working hard in the community. Let us begin by acknowledging that the land we are meeting on is the traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today's event will begin with the remarks from the Honourable Patty Hajdu, Minister of Health, followed by Owen Charters, President and CEO of Boys and Girls Club of Canada, and Gareth Jones, President and CEO of the Canada Safety Council. We're also joined by Jennifer O'Connell, Parliament Secretary to the Minister of Health, my colleague Kamal Khera from Brampton West. Thank you for the tireless work you do. And Councillor Jeff Bowman, thank you for joining us. And Michael Jovi, of course, from Boys and Girls Club. As you know, vaccine saves lives. It is simple history shows us how effective they have been in eliminating disease like diphtheria, polio, tetanus over the past century. Today, vaccination is critical in helping to end the COVID-19 pandemic we all know. In 2016, the Government of Canada launched the Immunization Partnership Fund to improve access to vaccine and encourage vaccine uptake. In 2020, this fund received $64 million to support projects aimed at improving vaccination coverage in Canada, including COVID-19. It is the time to ramp up efforts to reduce the spread of this virus. With schools opening back up, in little more than a month, we all know it's less than a month, we need to do everything we can to ensure that youth age 12 and over have access to the vaccines. I'm sure the Minister of Health would agree. Minister, before I end the remarks, I want to thank you for your tireless work in Peel and all of Canada. We cannot thank enough. When last year you were here to provide the isolation center, and thank you from our Brampton team, and then all Bramptonian, thank you.
Thank you.
Okay. So without further ado, I would like to invite our hardworking Minister Hajdu to the podium to make an important announcement.
Well, thank you so much, MP Sidhu, Sonia, Kamal, Khera, and Jennifer O'Connell are also here, and I almost feel like crying when I say that because we haven't seen each other in person like so many Canadians across this country. But it's wonderful to be with these incredible, fierce women leaders who are leading their communities and our country through this crisis. And in particular, thank you for your actual on the lines. We often thank frontline workers. Maybe you all know this here in Brampton, but of course MP Khera has been providing frontline nursing, and that sacrifice has not gone unnoticed by all of us. So thank you very much. I come from Thunder Bay, which is the traditional lands of the Anishinaabe of the Robinson Superior Treaty Area, and I live just on the tip of Lake Superior, and I'm very grateful to be here in the traditional territory of the Mississaugas of Credit and the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And I am also incredibly grateful to Canadians because all across this country, since COVID-19 first reached our shores, I have watched Canadians step up and sacrifice for one another. And they have done so willingly. And many of us have so many stories of things that we've seen in our own communities. Councillor, I'm sure you've seen how Bramptonians have stepped up to help each other, to volunteer, to keep each other safe, in many cases to close their businesses so that we could reduce the spread. And that is something I will carry with me to the end of my life, that profound generosity of Canadians to take care of each other despite how confusing and scary it was. And of course, our government's been there for Canadians every step of the way, whether it was through the CERB providing income supports for people who weren't able to work as a result of that sacrifice, or supports for small businesses who had to close their doors, often with an uncertainty about when they might be able to open them again. But really, it is a Team Canada effort, and everybody has been pulling together. Earlier today, I was happy to announce that another Team Canada effort, getting vaccines into this country, that we have reached a milestone of 66 million doses here in this country. And what that means is that every eligible Canadian has the vaccine to get vaccinated. We have enough, and it's a huge milestone. And you know that also, as we announced earlier today, was a Team Canada effort, with Canada, the government of Canada leading the way, buying the vaccines, paying for them all, distributing them to the provinces and territories, providing the technical expertise, supporting local public health units to make sure they had what they needed to vaccinate. And we're going to continue to do that. We are going to get this job done together. And that's why I'm here today. I'm here with the incredible Owen Charters, who I've worked with many times on many other things, and of course the Canadian Safety Council, Gareth Jones, because in fact it is going to take everyone to get to the place where we are all confident that Canadians are protected in their communities. We know that people get information in different ways, and that many Canadians still have questions about vaccination, whether it's safe, whether or not the information they're getting is information they can trust. And we know also that information that comes from trusted sources is one of the most effective ways to help reduce that fear of vaccination and to help people feel comfortable in not only taking that step to protect themselves, but also to protect their families. MP Sidhu is exactly right. Schools will be resuming very soon, and we don't want to see a year where our children have to go without education in class again. That's been really hard on kids. It's been really hard on families. But we also want to make sure that our kids don't get sick. And we know that although we're seeing reduced caseloads all across the country, that there is a chance that children can get sick with COVID-19, that they are vulnerable to getting really sick with COVID-19, and that one of the best ways that we can protect them right now, where there are no vaccines yet available for children worldwide, is for us ourselves to get vaccinated, so that we reduce the risk of introducing COVID-19 to them. So today it's very exciting to be with, as I said, the Boys and Girls Club and the Canada Safety Council, because in fact we're going to rely on partners like these two organizations to get that job done. Aujourd'hui, j'ai le plaisir d'annoncer deux nouveaux projets financés dans le cadre de ces programmes. Ces projets feront la promotion de la vaccination contre la COVID-19 auprès des jeunes de 12 ans et plus, des parents et des enseignants grâce à des campagnes en milieu scolaire. For the first one, Boys and Girls Club Canada, now renamed, congratulations, BGC Canada, will receive up to $500,000 in funding. And this will allow them to promote the benefits of vaccinating against COVID-19 in their communities. And for those of us who are so fortunate to have a BGC Canada location in our community, I can tell you they do incredible work, working with families that are often distanced from other organizations, that often don't have other trusted sources of information, and their children. And so this money will allow the Boys and Girls Club to take on this important role and help us get the job done. The second grant I'm announcing today is the Canada Safety Council. And the Canada Safety Council will receive $220,000 in funding to create a COVID-19 vaccine education and awareness program. And again, this will be delivered through schools with the support of teachers across Canada, again with the goal of helping students understand vaccination and helping them with the tools of information to have those conversations with their parents. This is very important. It's really important that everybody has credible information from people that they trust. In total, since 2020, we've funded 32 organizations with funding similar to this, so that they can share information in culturally appropriate ways, in languages that are best and most accessible to their populations. And we're continuing to also invest in grants for community-driven information campaigns and national information campaigns. Throughout the last several months, we've worked really, really hard with all partners at local and provincial and territorial levels to make sure that everybody has what they need to get through COVID-19 together. And we're going to continue that hard work. We will continue to have Canadians back until all eligible Canadians have received their vaccine and we truly are safe from COVID-19 in all of our communities. So I'm speaking directly to Canadians now. If you haven't been vaccinated yet, be safe, be sure, get vaccinated, protect your family, protect your community, protect the small businesses all around us that are relying on us to get the job done. Thank you very much.
Thank you, Minister. Now I would like to welcome Owen Charters, President and CEO of Boys and Girls Club of Canada, to say a few words. Over to you.
Sorry.
That's okay. Great. Well, thank you. Thank you. And hello, I'm Owen Charters, CEO of BGC Canada, formerly Boys and Girls Clubs. Bonjour à tous. Je suis Owen Charters, PDG du BGC Canada. First of all, big thank you to our Executive Director here in Peel, Michael Guiove, for hosting us at his facility today, and everyone on his team. It's great to be here and to see you as it is in person, which is so unusual these days. And of course, a huge thank you to Minister, the Honourable Patty Hajdu, and to MP Sonia Sidhu for hosting us and for these amazing grants, especially for this investment. This is an important one. And it's not just been this, it's been ongoing support of our clubs across Canada. Merci pour cet investissement et pour votre soutien envers nos clubs. I want to thank Minister Hajdu and the Public Health Agency of Canada and Health Canada for your continued leadership in this really challenging year and a half like no other. Je tiens à remercier la ministre Hajdu, l'Agence de santé publique du Canada et Santé Canada pour le leadership dont ils ont fait preuve depuis le début de la pandémie. I also want to thank all the levels of government, as well as our frontline healthcare workers, for everything that they have done and continue to do for everyone living in Canada. These have been exceptionally difficult times, and especially so for our young people. They've already been experiencing, prior to the pandemic, all sorts of challenges. Challenges of accessing healthcare or having barriers to healthcare, accessing a sense of belonging in their community. And of course, what we see in our clubs are those effects magnified and magnified many times over during a pandemic. And especially here in Peel, what we've been proud of is that our clubs have stepped up to support young people and their families. La dernière année et demie a été très difficile et nos clubs se sont mobilisés pour soutenir les jeunes et leurs familles. We, working in our clubs, have increased all sorts of programs, including food security, developed and implemented high-quality and safe virtual programming to sustain those critical mentor-mentee relationships between local club staff and young people. And now, through this funding today being announced, and through the Immunization Partnership Fund, clubs across the country will support community-based COVID-19 education, outreach, and vaccine promotion. On a amélioré nos programmes d'aide alimentaire, développé des programmes virtuels, sécuritaires et de qualité, et maintenant, grâce au financement au Fonds de partenariat d'immunisation, nos clubs contribueront à l'éducation et la sensibilisation des communautés à l'importance de la vaccination. Throughout the pandemic, our clubs have helped mitigate the worst public health outcomes, leveled some effects of long-standing social inequities, strengthened community capacity, and established an ethic of care for our most vulnerable. This funding allows us to continue these efforts as we look to successfully end the fight against COVID-19. Through the leadership also of our National Youth Council, we will be developing youth-targeted evidence-based vaccine videos and engaging youth in a video contest. To support parents, guardians, and club communities, BGC Canada will develop resource materials using content from Health Canada about the COVID-19 vaccine to disseminate out to our members in over 7 languages based upon club needs. Together, utilizing all the tools in our combined toolboxes, we can turn the tide on COVID-19. Our clubs know the importance of credible and evidence-based health information and are grateful to the Government of Canada for this support that will allow us to scale up our efforts to fight COVID-19. Merci.
Thank you, Mr. Charters. Now I'd like to welcome our last speaker, Gareth Jones, President and CEO of the Canada Safety Council, to say a few words.
Well, good afternoon, everyone, and thank you to Minister Hajdu and for MP Sidhu for being here today to acknowledge the Boys and Girls Club of Canada and the Canada Safety Council for the work that they're about to embark upon. You know, it occurs to me, I mean, I think of things in terms of where we've been, where we are, and where we're going, and where we have been is fairly significant, has been a significant effort, right? And it's not been lost, I think, on a lot of people that we're here today. We're talking about next steps in terms of communication and how we can extend the reach of our communication forward because of the successes that we've had here. So I really want to thank Health Canada, Public Health Agency of Canada, as well as the reach across Canada, which includes provincial, territorial governments, municipalities, communities, and ultimately the people of Canada who came forward, stepped up, took in the information and did the right thing. And that's what got us to this point, right? So going forward, the Canada Safety Council realized that we can play a role in the youth sector. We play in a number of different spaces. We're involved in safety of all matters across Canada, but we have one of the 4 pillars is youth safety. And inside of youth safety is a property and a program that we call Elmer the Safety Elephant. Some people will be familiar with Elmer the Safety Elephant and may have taken the program in their formative years in school, but this is a program that was initially launched in 1947 to meet the need of ensuring that kids were getting to and from the school safely. There were too many incidents and so forth, and so in the first year of its implementation there was a 44% reduction in those incidents. From that point the program grew very quickly, both in the City of Toronto and across the nation, and the program that started in 1947 continues to this day. I in fact took the program in grade 2, not in the inaugural year, but certainly a little later, and to this day I remember in my head when I cross the street I think in terms of look left, look right, and look left again. And it's funny how these things, when they're instilled in you at an early age, can kind of follow through in a lifetime. And so it goes with vaccination. The program that we've been funded for allows us to communicate to a specific audience, right? And I think really this is the last mile in terms of what we're doing in the pandemic, is how do we reach Canadians in a very targeted and specific way that makes sense to them, and so that they can receive information, digest it, and make appropriate and informed decisions. When it comes to kids, you can only imagine, I mean, the misinformation that has existed across the nation over the last 18 months has been phenomenal. And although we've shored that up, you can only imagine what that's like in the playground or in the school environment. So it's really important to take voids of information and fill it with fact that's grounded in science, that's credible, and that kids can take forward, right? So that we can displace misinformation and move forward with the right information. These conversations can take place in the classroom initially, but also carry forward into the school environment and into the communities and the homes of the children that receive the information. So we're really excited about doing this. And if I could just say a moment, you know, for teachers, my wife is a teacher. Teachers love pre-packaged lesson plans. This is what we've got. We've got a pre-packaged lesson plan that's targeted specifically, it's age appropriate for the primary, intermediate, and the junior divisions within the elementary schools, and it's appropriate for use across Canada. It's been vetted by the educational community and the medical community. So I think that it's a program that you're going to enjoy. I would encourage you to download it. It's not available just yet, but when it's accessible in mid-September, I would encourage you to take a look at it and share it to the extent that it's possible with your students, right? Again, this is just one slice of the total effort, and when I think about, you know, where we've been and where we're going, I mean, there's still, the last mile is tough, right? Sometimes that's the tough territory to cover, but we can do it. Right? We've gone this far. We've had some great success, and we're happy to contribute to the ongoing communication that's necessary to get us to that finish line. But we know that we're a piece of it, and we look forward to sharing the results of our program, as well as to taking a look at the overall impact of the funding initiative and the results that we know that will definitely come. But again, thank you for the opportunity, and thank you, Minister, for being here to provide that information for us. Thank you.
Thank you, Mr. Jones, and thank you all the speakers. We are now proceed to the media Q&A, question answers.
Hi. Minister Hajdu, I have a couple questions for you. I'm Lisa Hefner from CHCH. I want to ask you, yesterday in Hamilton, we heard from the Public Health Department that youth 12 to 17 in Hamilton, 66% have had a first dose and 43% a second dose. So does that seem low to you? Is that a concerning number? And if so, do you think this communications outreach will be enough to turn the tide?
Well, thank you for the question. And first, I'll say that we're shooting for the moon. We want every eligible Canadian to be vaccinated. This is how we will protect ourselves, protect our communities, protect our economy, and really reduce the suffering that COVID-19 represents for all of us, both on the public health measures that it takes to keep COVID-19 at control, and also the suffering of people and their families who contract COVID-19. Provinces and territories, as you know, have the responsibility to provide health care, and will continue to be there for provinces and territories with what they need. But like I said in my remarks, this has always been a Team Canada approach, and we will stop at nothing to support incredible community organizations like the ones here today to access money and support to do that kind of education and information providing that is necessary to help break down some of those barriers. There will be pockets across the country where we see higher rates of vaccination and lower rates of vaccination. But again, it will be, I think, a team effort that will allow for people to feel comfortable in making those choices for themselves. Besides these two great organizations, I was in Manitoba last week, and I had an opportunity to meet some of the Vaccine Innovation Challenge grant recipients. This is a smaller amount of money. It's going directly to very small, not-for-profit organizations, and I met two of them. In fact, one Indigenous Health Center. They're working directly with the Indigenous urban community, providing all kinds of supports, including smudging and traditional practices and meetings with elders. And another group called Women in Color, which is run by Canadian Chinese women and provides information in Mandarin, group settings where people feel comfortable to ask those tough questions. That's how we're going to reach the rest of Canadians, is by having conversations with them one-on-one. And I can fully agree with Gareth, the last mile is the hardest. But we can get there. We can get there if we hold each other up, if we support each other, and if we remember that this is about protecting all of us. Finally, I'll say this. We don't have an approved vaccine for children 12 or under anywhere. We know that I was just meeting with Pfizer and Moderna at the announcement just prior to this one. We anticipate they will submit to Health Canada in the fall, but until they actually submit the approval, we know that our children are unprotected, and children can get COVID-19. Children can get very sick with COVID-19, and I don't think any parent wants to see their child struggle in a hospital bed, or have to stay home for work, for school, or, God forbid, have an outbreak in a community that requires school closures. So this is the time for all of us to pull together and to finish that job.
Understanding that healthcare is a provincial responsibility, but as a federal health minister, do you have any position on whether vaccination should be mandatory in any setting, like schools or long-term care, for example?
Okay, well, thank you again for the question. And as you know, this is a provincial, territorial, and in some cases, individual organization decision. In my riding, for example, of Thunder Bay, both post-secondary institutions have decided to make it mandatory for students to be vaccinated, and I anticipate we'll see other settings like that, where people will determine that for the safety of the community they serve, they want to see vaccination. This is not unusual, by the way. In fact, for school children, most provinces have requirements around vaccination for childhood illnesses that are necessary to demonstrate before a child's enrolled in kindergarten. So I anticipate that work is happening at the provincial and territorial level. We'll continue to be there for provinces to make sure they have what they need: supplies, education, support in terms of access to vaccines, and obviously anything else that may arise as we continue to protect each other.
I'm good.
Thank you. All right. Well, okay. Well, thank you very much, everyone, and thanks for coming today. And I think, with incredible partners like this, I think we are in good standing to be able to reach every single Canadian and make sure that we use those vaccines that are there to protect them. Thank you very much.